good evening, wherever you are joining us. Hello, everybody. Welcome to the Anal Cancer Foundation's Facebook Live Thriver session. My name is David Winterflood. I am the director of the Anal Cancer Foundation in the United Kingdom, and it's my pleasure to welcome you to this live Thriver session today, and an even greater privilege to introduce Falline, who will be sharing her story with us and is joining us today. Welcome, Falline. Thank you for being with me. If I could start off with our first question, could you tell us a little bit more about your journey with anal cancer and how it's led you to becoming a peer mentor?
Sure. Always happy to tell my story. It was late 2018 when I noticed a little bit of rectal bleeding, not a whole lot, and it wasn't painful. So when I went to my new primary care doctor for a pre-op clearance for surgery for my second knee replacement, I mentioned it. So her total investigation into why I had anal bleeding was to just have me lie on the table, and she took a flashlight and looked at my butt and said, "Oh, hemorrhoids." Since I really wanted to get my second knee done, I wanted to be done with doctors for a while. I accepted this, even though I felt something was a little different than it had been previously. So I had my colonoscopy, which had been scheduled and been delayed slightly by the knee surgery. And my GI doctor found stage 3A, T2, N1, M0 anal cancer. So I guess I wasn't going to be through with doctors for quite a while. Uh, so with He immediately referred me to UCSF's ANCRE Center. That's the Anal Neoplasia Clinic Research and Education Center. And within 48 hours, Naomi J was examining me. And as much as I didn't want her to, she confirmed the anal cancer diagnosis. But she then told me about the Anal Cancer Foundation and asked if I'd be interested in having a peer counselor, which I jumped at that idea. I knew nothing about cancer, knew even less about anal cancer, and anybody who would take the time to talk to me, help calm my fears, and answer questions, and just be a friend was exactly what I wanted and needed. So that's how I got I got to know about the Anal Cancer Foundation. Um, I went to the website, I filled out the form, and within a week, Laura had matched me with Judy, who's this wonderful woman in Florida, who's my very good friend to this day. As I went through treatment, I saw a nutritional oncologist, and within a few weeks of completing treatment, she introduced me to another woman who had anal cancer, and asked if I'd be willing to talk to her. So, of course, I said yes. I was more than happy to give back some of the wonderful support that Judy had given me. By the time I was 6 months post treatment, which is when you're eligible to be an ACF peer to peer counselor, I had already counseled two women and was really happy to be part of this whole mentoring project.
Fantastic. And if I could sort of dive into that a little bit, Celine, could you share the sort of support and guidance that you provide to newly diagnosed patients through that process? So some examples of how you've helped others.
Sure. Um, well, people get referred to me in many ways, from ACF, from Sutter Health, which is where I got my treatment, from friends, from other butt buddies, and I meet people who are newly diagnosed, people who are going through treatment, and people who have even completed treatment. So for the newly diagnosed, the first thing is to let people know they're not alone. Other people have gone through this, they've gotten through it, and life goes on. Maybe not exactly as they would like, but that's okay. Um, I also share techniques for minimizing some of the problems that we have during treatment. An example, a nurse told me that switching from mint toothpaste to regular toothpaste would cut down on mouth pain. I don't know why, but it does. The other thing for mouth sores, which a lot of people get during chemo, is to use the baking soda and salt mouthwash after every bite you take. Every calorie that goes in your mouth, rinse it out. My doctors had recommended 4 times a day. I'm a nibbler, so I was using it 12 times a day. And I had like 1 or 2 mouth sores before I figured that out, and then no more. But I think the most valuable thing I do for the people that my butt buddies, as I call them, is just, well, I know it has another meaning, but words can have more than one meaning.
Absolutely, absolutely, Falline.
Yeah. So, as I normalize their experience, it's like we're experiencing things we've never experienced before because we've never had radiation and chemo on our butts before. So just to go, yep, that's perfectly average for what people are going through. Yep, you pooped 20 times yesterday. Uh-huh. You know, that's, you're not dying. It's just part of the process. So, and this disease is caused by a virus that's sexually transmitted. So people have, and it's in the most maligned organ that human beings have. We don't like our butts. We should. It's a wonderful organ, but it doesn't have good press. It really doesn't. Anyway, so people need to talk about what's going on, and just finding somebody that they're comfortable with and can be honest with is just invaluable at this stage. And I provide a safe space for people to talk about what's bothering them, what they're experiencing. Um, and I often hear that Americans, and probably everybody around the world in the 21st century, that there's an epidemic of loneliness, that we're just getting more isolated as we get more and more into our devices, and there's less and less human contact. So, and anal cancer and cancer in general is isolating. People don't want to reach out when they're sick, but it is so important to have connection and to have support. So, you know, this disease is hard enough without layering on shame or isolation. But there's also the physical damage from chemo radiation. We have to eat, and therefore we have to eliminate waste. Radiation beams do not have pinpoint accuracy. It's not like it just hits the tumor, it hits the whole region. So we have damage not only to our anuses, but intestines, genitalia, urinary tracts, and our bones are damaged. The flat bones in our hips are where most of our red blood cells are produced, and that makes us sick too when that's not functional. Plus, there can be pelvic insufficiency fractures. These are all things that are possible, and it's no wonder that everything hurts. But our doctors don't always fully understand our issues. Um, so let me
Yeah.
give you a personal example. I intermittently had pain on urination when I was going through treatment, and when I told my doctors about it, they prescribed an antibiotic for a urinary tract infection. This didn't help at all because that wasn't the problem. The problem was that there was hot pee touching my burned skin. Acid on burned skin, not a good combination. It hurts like
Right.
hell.
Yeah.
So, you know, that, and I would have expected that my doctors would know this, but they didn't. So it was more a question of figuring out how to sit on the toilet to have the least amount of contact with the pee as possible, and also sitting in a sitz bath, peeing in a pool of water help, or having a peri bottle can give relief. But that's the sort of story that we know and our doctors don't, and that we need to share with each other. One more example: a friend who had been through treatment had gotten an abnormal uh, biopsy and was wondering what it was like to be treated for HSIL. I had had this procedure, so I understood what bifurcation or electrocauterization was, and it's just basically a process where the offensive cells are burned off I explained the process to her and then added that there was one little benefit other than getting rid of a pre-cancer, which I enjoyed, which was that for one brief moment in my life, I could honestly say that I had one smoking hot ass. You know, you gotta laugh. I mean, this stuff is tough, and I honestly think that laughter is one of the most healing things we have.
Yeah. Yeah. I think it, and I think that goes to. I always love hearing you talk, Falline, and reading things that you've written previously because of that that levity you bring to what can be a very challenging set of circumstances, and I think, as you say, humor goes a long way, especially in these difficult times, and laughter brings people together, which we know from the peer program is so important. And maybe on that, if I can segue into, why do you think the peer-to-peer program is so important for patients who are going through treatment for anal cancer?
Well, because we learn from each other. It's We are the depositories of the knowledge of how to get through things. We've also learned. I've done a lot of research because once this affects you, you're going, what's going on? You want to know everything you can in order to heal as best you can. So when you're brand new, your brain is on fire. You just cannot concentrate. You cannot think. So to have someone just say, oh, been there, done that. This is what this is all about. So our, we know more about, those of us who've been through it know more about this disease, at least with the day-to-day practical aspects of it, than our doctors do. Certainly more than our primary care doctors, who very rarely see it, and even oncologists don't see it that often. The There are about 13,000 oncologists in the United States and fewer than 10,000 cases of anal cancer. So even the average oncologist, who's our specialist, sees a case about once every 16 months. So with all the other kinds of cancer they're dealing with, to expect them to have in-depth knowledge of anal cancer, not going to happen. It's not that they don't care. It's not that they don't want to. It's just there's just so much a human being can know. So that's why it's so important for us. Um, and the NIGRO protocol, which is the standard treatment for anal cancer, is 50 years old this year.
Yeah.
50 years. So we've got old chemo drugs, we've got old ideas about how much radiation is appropriate. I personally think I got way too much. I think my tumor was gone and they're still bombing the hell out of my butt. So it's just that, yeah, we are the keepers of this knowledge and we need to share it with each other. And there are also the emotional issues. There's the shame of having a sexually transmitted disease. It's like, whoa, I didn't sign up for this. And it can be latent. I mean, I, I think I picked this up literally over 50 years ago, and it's just been latent in my
Right.
body ever since. Um, so almost everybody gets some form of HPV at some point in their life. And it's not like those of us who've been visited with anal cancer did anything wrong or particularly weird, or not like one friend asked me when I told him I had anal cancer. He said, oh darling, what did you do to get that? And the answer is I didn't necessarily do
Nothing.
anything, and if I
Yeah.
did, it's none of his damn business. So
Right.
um, and yeah, the incidence of anal cancer is on the rise. So yeah, we just need to share this information.
Totally. And Falline, to your point, I always say to people, the clue's in the name. It's human papillomavirus. Your risk of getting the virus is simply by being a human being alive on this planet. That is your risk profile for this.
Absolutely.
Um, Listening to you speak, could you share about how this experience as a peer mentor has impacted your own life and recovery? And I always enjoy talking. You're so well educated on this issue, but it seems like there's been the journey that you've been on within your own journey with treatment, but then through the peer program as well. Could you share any particular memorable moments of being part of the program?
Um, I remember the first time Laura matched me with a new peer, and I was just so nervous because I was now an official Anal Cancer Foundation representative, and it was just lovely. But I was nervous about the whole thing, and here I am. There's this woman who's has her own law firm, and she's going through this, and a very high-powered, intelligent, delightful woman. And it's our first conversation, and with 15 minutes, I'm asking her about her sex life. It's just like it's crazy, but it's wonderful too. Everybody I've talked to has has become a friend to one degree or another. Everybody's been very different, and I found that if in the first half hour of meeting someone, you can talk about cancer, poop, pee, genitalia, and sex, you can talk about anything, and you have an intimate relationship.
Yep.
So, except with the possible exception of money, but um, at this point, I've probably talked to or mentored 20 to 30 women and a couple of men, and it keeps me busy, and it keeps me feeling like I'm earning my kibble, now that I'm retired, and, you know, I have the time, so it's great that I can do it. Um, and as my network of anal cancer people keeps expanding, I realize that virtually everybody has some long-term after effects. And people who don't live close to an enlightened medical center have a tough time getting adequate care. There's just the follow up is just not there. It's not monetized. Um, our medical system, I don't think it's quite so bad where you are, David, but here it's all about the money.
Mhm.
Medical care is big business more than it is care. And that's just our reality right now, and we have to work with it. And, I hear stories about people who had bleeding and severe pain, and it took them years to get diagnosed to the point where they were late stage 3 or stage 4, or even at least, and sometimes these people die because people won't take us seriously, won't
Mhm.
examine us, when we first complain of bleeding or pain, and it's just a crime, and it it just bugs the hell out of me. Um, and how it's changed my life while I was going through treatment. I mean, I had no concept of what it was like to have cancer. I had never had a close friend or family member with cancer, so everything was new and scary. And I learned very early on in my life to reach out to friends for help when I was in trouble. So I sent out emails pretty regularly, sometimes more than once a day, about what was going on with me. And I've turned those emails into a book, which I hope to publish. I'm not probably self-published. I've almost given up on finding a publisher at this point. And the working title is Talking Out My Butt, One Woman's Journey to Anal Cancer and Beyond. You like the pun in there?
Absolutely, absolutely. I wouldn't expect anything less from you. Brilliant. Well, you touched upon your journey. Could you share with those people who are watching who might be interested in becoming a mentor or seeking mentorship themselves? Can you explain that process of signing up and what they can expect from that process and the program?
Sure. Um, it's really pretty easy. You go to the website, which is analcancerfoundation.org. Kind of going to refer to my notes a lot because I want to get this right. And once you're on the website, you find and click on Find Support. Then it's Patient Support. Then connect with a peer, then register for P2P program, and then Thrivers. And that's the same for if you're seeking help or you want to offer help. Under Thrivers, those paths diverge, and you can click on either become a volunteer or request a volunteer. Each of those will send you to a questionnaire where you can talk about yourself, your relationship with anal cancer, and your contact information, how you like to communicate with others. And once you complete the questionnaire, if you're seeking help, Laura does a great job of getting you matched within a week usually. So the treatment for anal cancer is relatively quick, so it's important and wonderful that she can do this so quickly. Um, and if you need I do recommend that if you've been diagnosed with anal cancer, that you get a butt buddy. Just somebody you can talk to, somebody you can be honest with, unashamed, and talk about those little details of, you know, gee, I put Aquacore up my butt because it hurts inside? It's like, you can't talk to your friend about that unless they have
Right.
some experience. You need somebody who knows and somebody who's unashamed and can talk about stuff. So, and if you're at least 6 months post treatment, then I really recommend you try volunteering, even if you think it's not for you or you can't do it. Give it a try. If it doesn't work, Laura will bail you out either by giving you the information you need or say, thank you. If you really don't want to do it, we'll find somebody else to help this person. So no harm, no foul. Give it a try. It's been honestly one of the most rewarding experiences of my life. Kind of a weird way to come into something I love, but that's how it worked for me.
Thank you, Falline. And I think you make a valid point on that question of is it right for me? People converse in many different ways. Some people converse like this over video calls. Some people just over the phone. Some people over email. So it can be tailored to what's the most appropriate for the parties as part of that. So we do we're incredibly grateful as an organisation to all the volunteers who do an amazing job, like Falline. And Falline, thank you for sharing your story. It's been I'm truly grateful for that. We do have a little bit of time for some questions for you.
Could I add one more thing, David?
Of course you can, Falline, please. Yeah.
Yeah, I just wanted to say that research is finally getting to the point of trying to find something to replace the NIGRO protocol for us, and I'm very grateful for that. But I think where we really need to put a lot of effort now is in educating frontline doctors so we get diagnosed earlier, because there's a lot of a lot of misery that could be avoided if somebody would just do a digital anal rectal exam when we first present with symptoms. It's quick, it's easy, it's cheap. There's no reason doctors aren't doing it except they don't want to stick their finger up your ass, and it's their fucking job. Excuse my language. And
no, I think you're more than justified in doing so today. I've got a question from Richard Goldman. Falline, can you say something about how you were trained or oriented by the Anal Cancer Foundation to be a mentor? So how Laura sort of coached you through that process?
Yeah, there was a lot of literature I remember reading through, and one of the things you had to agree to was no bad language. We talked about that, and she gave me an exception because I can't talk without bad language, at least not honestly, for very long. But and Laura has always been available via email or otherwise. If I have a question or need anything, it's been wonderful. Thanks for the question, Richard.
Thank you, Richard. Do we have another question from Anne? How do you suggest we make our primary care doctors and gastroenterologists aware of anal cancer so they don't just tell us it's hemorrhoids?
I actually wrote a short script, which I'm calling What's That Junk in the Trunk, which is my version of what a conversation would be with a frontline doctor, which is sort of like, if we have symptoms, do a check. And he's going, well, there's a vaccine. Well, the vaccine isn't helping us or won't help us for 50 years. We're still going to have anal cancer. And it's also, it's like, get over it. It's cheap, it's easy, you got everything you need. And it's so important to get diagnosed early.
Yeah, absolutely.
I mean, just
go.
yeah,
Sorry,
just talk to your doctors.
Yeah. How? I'm not sure. Yeah. So Charlie's asking around liability issues during counselling, and that's part of the, in terms of the issues. Perhaps I can handle this one. It's not about dispensing or diagnosing the issue per se, is it, Falline? It's there that you can share your experience as in terms of your journey, but you're not there to provide a diagnosis yourself of someone's condition. I don't know if there's anything that you'd want to share on top of that.
Yeah, I do. One of the things I find I say a lot is I'm not a doctor. I can't give medical advice. I can share my experience, and I can tell you what worked for me. I can tell you what worked for somebody else.
Well, we've got a nice comment. Anne is asking about where do we locate that article. I guess, presumably that's the is that the Junk in the Trunk article? Have you published that one, Falline? Or is that a work in progress at this stage? Okay, so watch this.
I sent a copy to Justine and to Laura. They've seen it, but I haven't produced it yet. I'm hoping that I'll be able to do that soon.
So that's a watch this space on that one, which I think we're all what we're all looking for. Barbara commented that in terms of the British blog for anal cancer, and there are differences in treatment between the NHS and the US. Absolutely, Barbara. I think if I may, as the Brit, and I mean, Falline, you're welcome obviously to comment. I think absolutely there are differences in treatment. But in terms of managing side effects of treatments, there are a lot of commonalities, which we know that thrivers face as part of that. And there are those sort of broad umbrella issues such as pain, social stigma, and support from family, friends, and tips to manage side effects, which are common. I don't know if you've had any transatlantic friendships as part of this journey, Falline.
Well, unless you count you and Laura, and no,
okay,
not so far.
Yeah. Did we have? I think we've got time for one more question. So we're almost at time. Did we have one more? No. Okay. Well, Falline, I'm incredibly grateful for you taking the time today to share it, and I really hope to those of you who've been following along, this has been useful and edifying for those of you as well. A reminder that if you are looking for information, please do check out our resources at analcancerfoundation.org. We have information from newly diagnosed to information around treatment to managing the side effects. In addition to our free peer-to-peer support program, which Falline has very kindly talked about, which matches thrivers and caregiving volunteers. So with that, I want to offer a final thank you to Falline. We're so grateful for you taking the time today and for sharing that wealth of knowledge that you've gained on this journey, and the levity and confidence with which you speak about this issue. So thank you, everyone. Thank you, Falline, and have a lovely rest of the day where you are. Bye, everyone.
Thanks.